Hi guys, welcome back again. Today I'm gonna talk to you about idiopathic pulmonary fibrosis, IPF. Okay, so let's focus on the term by itself, IPF. Idiopathic, which refers to a disease without known cause or mechanism. Pulmonary refers to lungs. Fibrosis refers to excess collagen and connective tissue or interstitial tissue between cells, usually after tissue damage. Okay, so idiopathic pulmonary fibrosis is ongoing repeat process of having excess collagen and scar tissue in the interstitial tissue of the lung. Okay, so it's a chronic process that leads to progressive loss of lung tissue. We can define as progressive fibrosing interstitial pneumonia of unknown cause, okay, occurring in adults. Although there's unknown cause, but there are a lot of triggers, okay, that causes scarring process to begin, such as smoking, viral infection, and heartbeating, and it usually occurs after the age of 50. Okay, so the patient got idiopathic pulmonary fibrosis, for example, and the patient comes to you, has complaint of shortness of breath and dry cough for long duration. Okay, this is what patient got during idiopathic pulmonary fibrosis, and patient presents as in the hand general inspection: hot, peripheral cyanosis, clubbing, and central cyanosis. Okay, most probably refers or belongs to respiratory cause, shortness of breath. So clubbing and central and cyanosis, as I mentioned in the previous video, there are only 5 causes: 2 respiratory, 2 cardiac, and 1 liver failure with subpleural shunt. Okay, so let's focus on the respiratory. There are only 2: widespread bronchiectasis, and the second one alveolitis fibrosis or fibrous alveolitis. This is our object. There are important questions of a case of fibrous alveolitis. Okay, so you need to ask about, first of all, age of the patient. Why? Because, as I said, usually occurring in adults age. Okay, 50, 60 to 70 or more than that. Okay, get more danger, even malignancy. Why? Because the prognosis is bad. Okay, well, because it is idiopathic, but in young patient with fibrous alveolitis may due to secondary, not idiopathic, or congenital. Okay, this is the first one, age of the patient. The second one, we have occupation of the patient. Okay, why? Because those working with dusty environment have a high risk to get idiopathic pulmonary fibrosis. The third one, we have family history. Why family history is important? To exclude congenital cause. The fourth one, which we have to ask about, is arthritis, history of arthritis or not. Okay, why? Because 50% of patients got idiopathic pulmonary fibrosis due to connective tissue disease, SLE or arthritis. Okay, this is regarding the fourth one. The fifth one is drug history, cytotoxic drug and cardiac drug like amidron. It's danger. Why? Because of its side effects. So what are the side effects of the amidron? We can say BITCHA, B-I-T-C-H-A. Okay, B for bradycardia, I for interstitial fibrous alveolitis, T for thyroid, hypothyroid or hypothyroid. Okay, C for corneal deposition, H standing for for hepatitis, and A standing for for adult. So you have to mention cardiac drug. And the last one, ask about his or her hobbies. Okay, what's he or she's doing after work. Okay, bird fancier, ask about. Okay, if yes, most probably fibrous alveolitis idiopathic. Okay, this is regarding asks. You have to mention and you have to ask about it to the case of idiopathic pulmonary fibrosis. And when you put stethoscope on his or her chest, you'll find fine crepitation. Okay, And when your examiner asks you to examine his or her abdomen, you have to looking for what? Organomegaly. I mean liver, spleen, and para-aortic lymph node. Why? Because sarcoidosis can cause fibrosis in the lung in stage 3 and 4 can cause what? Organomegaly. And now let's jump to what? To investigations of the case of idiopathic pulmonary fibrosis. However, it's difficult to diagnose a patient with idiopathic pulmonary fibrosis as its symptoms more or less often similar to other lung conditions. But if you suspect that he or she got what? Idiopathic pulmonary fibrosis, you can send the patient for what? For laboratory investigations, radiology, I mean chest x-ray as a bilateral lower lobe and subpleural reticular shadowing. Okay, the chest x-ray may be normal in what? In individuals with early or limited disease. The second one, we have high resolution CT, which demonstrates a patchy predominantly what? Peripheral, subpleural, and basal reticular pattern, and in more advanced disease in the presence of honeycombing cysts. Okay, and tractions bronchiectasis when this features are present. HRCT, I mean high resolution CT, has a high positive predictive value for what? For the diagnosis of idiopathic pulmonary fibrosis. Okay. And the third one, we have what? Pulmonary function test. Pulmonary function tests typically or classically show what? A restrictive defect with reduced lung volumes and gas transfer. Okay. And the fourth one, we have what? Bronchoscopy. In the bronchoscopy, which involves passing a camera or a small camera, okay, through your nose or your mouth, okay, and into your lungs, I mean to see what they look like or to take a sample. And as you know, lung disease can be divided into obstructive and restrictive, okay. In restrictive lung disease, there is a problem, okay, getting the air in. Okay, there is a problem getting the air in, okay, which low complex, inspiration is difficult, and more fibrous tissue means fibrosis, which high elasticity, increase elastic recoil, okay, so expiration is easy. Okay, this is very important question. You have to know about it when someone asks you how does idiopathic pulmonary fibrosis affect the lungs, okay. First, let's see how the lungs work together. Okay, when you breathe in, the air ends up in tiny air sacs called what? Alveoli. Okay, where oxygen can move into the bloodstream and CO2 gets taken out. Okay, but in pulmonary fibrosis, scar tissue built up over time around the alveoli or air sacs. Okay, so which makes it what? Harder for what? For oxygen to move or into the body, So this leaves you what? Feeling more as of your shortness of breath than usual. So the main symptom in this condition is what? Are shortness of breath and persistent dry cough. Okay, and the lung disease can be divided into obstructive and restrictive. In obstructive, the problem is what? Can't get the air out. Can't get the air out, like asthma, COPD, bronchiolitis, and bronchiectasis. While in restrictive, our problem is what? Can't get the air in. Those ends with osis. Like asbestosis, idiopathic pulmonary fibrosis, okay, pneumonosis, with which restrictive can be divided into what? Extrinsic and intrinsic. In extrinsic, like kyphoscoliosis, Guillain-Barré, pleural thickening, diaphragm paralysis. Okay. Well, in other hand, we have intrinsic restrictive pulmonary disease, which can subdivide into non-parenchymal and parenchymal. Non-parenchymal, we have alveolar proteinosis, and parenchymal, we have occupational and what? Idiopathic interstitial pneumonia, which means idiopathic pulmonary fibrosis. Okay, the third one, which is others. So by the way, we can say idiopathic pulmonary fibrosis belongs to lung disease, okay, and then restrictive. Is it obstructive or restrictive? It is restrictive. Okay, then is it intrinsic or extrinsic? It is intrinsic. Then, is it alveolar or diffuse parenchymal? It is diffuse parenchymal. And finally, unknown etiology. So we can say lung disease, regarding to idiopathic pulmonary fibrosis, lung disease, restrictive, intrinsic, diffuse parenchymal, and unknown etiology. Unfortunately, there is not yet a treatment that can cure idiopathic pulmonary fibrosis, but there is medication can reduce the symptoms and slow the progress of the condition. Okay, pulmonary rehabilitation has been shown to benefit people with idiopathic pulmonary fibrosis. Hope you get a benefit from this video. Thanks for watching. Don't forget to make dua for me.